South Korean health officials plan to look into managing COVID-19 like the seasonal flu, but experts seem to be divided about when is the right time to make this shift. Yeon-seung sheds light on this issue.
Can COVID-19 be treated like the seasonal flu in South Korea? This would mean no more strict social distancing and contact tracing. Health officials would no longer treat COVID-19 as a special disease, but rather as one that's regularly circulating. But the top health official at the Korea Disease Control and Prevention Agency, Jeong Eun-kyeong, says it's still too early for this shift. She said Monday that COVID-19 is much more infectious and more than twice as deadly as the seasonal flu. So making this change would be premature. But not all experts are on the same page. Dr. Jeong Eun-kyeong says that the government analysis compares the flu with all the COVID-19 trends seen so far. But she thinks the comparison should be made only with Omicron.
We have to make the change now. Omicron's fatality rate is 0.15% before the COVID-19 oral pills. If the pills are administered early, the fatality rate drops to almost next to nothing. It's much less fatal than the flu, and if you see infected patients around you, they suffer weaker symptoms than the flu.
Another expert says that the country still needs to wait at least a month or two.
It's a very dangerous situation. I think we still have to go through the infection peak and then make sure our medical system is able to handle this change. I think infections will rise at least until the end of February or the middle of March.
But all agree that this change is inevitable. And to make sure that this shift is made in the safest way possible, vaccinations need to increase. Oral treatments need to be widely used. And self-testing kits need to be more accessible. Yeon-seung, Arirang News.